Thanks so much for coming in today. After I reviewed everything, there are just a few things I want to go over with you. Um, you did tell us that you drink a lot of sugary drinks. This included energy drinks, Coke, juices, and you like to drink these several times a day. Um, so the only thing bad with that is if you're drinking it throughout the day, it almost makes your teeth be in like an acid bath. So the sugary drinks that you're drinking makes your saliva more acidic. And so the environment in your mouth is very acidic when you're drinking these sugary drinks. And so we want to try to limit this. So I would just recommend, if you could do this, pick maybe one of your favorites and drink maybe just one a day. And instead of drinking it throughout the day, just go ahead and drink it right there, all at one time, and then rinse out with water afterwards. So if you're drinking just one instead of drinking a whole bunch throughout the day, that will limit the acidity in your mouth. So when the environment in your mouth is very acidic, it sets up the perfect environment for cavities. And obviously we don't want you to have any cavities, so we want to try to limit these sugary drinks as much as we can. So I would just recommend try to pick one that's your favorite and just drink one per day. And after you drink it, go ahead and rinse your mouth out with water, because this goes ahead and neutralizes that environment in your mouth so that it's back to normal and it's no longer putting your teeth in an acid bath. And then maybe the next day you can pick a different one, but I would just really recommend trying to limit the sugary drinks. I did see that you had some cavities in the past, and so we really just want to prevent this as much as possible. The next thing I wanted to discuss with you was the type of toothbrush you're using. You told us that you were using a hard bristled toothbrush, and this is not only bad for your teeth, but for anybody's teeth, for anybody's gums. Your gums are obviously a little bit red, a little bit angry. You said that they bleed when you brush. Now this could be from the toothbrush as well, I'm sure it is, but it's also from your gums just being inflamed and red. So that plaque that is on your teeth is causing your gums to be red and inflamed and irritated. It's almost like a splinter. When you have a splinter in your skin, the skin around it becomes red and irritated. That's the same thing with your gums. So this plaque on your teeth can also harden, and it turns into what you know as tartar. So this tartar also acts as like a splinter, and that plaque and that bacteria and tartar in your mouth is causing your gums to be really red and irritated. And when you're using a hard toothbrush, this makes it even worse. So I would recommend using a power toothbrush. I like to recommend this to all of my patients. It is just proven to get that plaque off a whole lot better, and so you can intervene it turning into that tartar. So we want to really go ahead and do that. You said that when you use that hard toothbrush, you like how it makes them feel clean. Well, I promise you that the power toothbrush will do even better. It will really make you feel like you've almost gone to the dentist and gotten your teeth clean. But if you want to think about the power toothbrush, that's totally fine. I would recommend using a soft bristled toothbrush. So this is really going to be way easier on your gums and even your teeth. The hard bristled is even hard on enamel, and so we want to recommend a softer bristled brush. If you do this, we'll show you how to brush, and you'll still get that clean feeling that you like to have from the dentist. The last thing I want to talk to you about is your smoking. So you've been smoking for 9 years, and I know that that is so hard to quit cold turkey. So we're not asking you to do that. I know that you probably know that that puts you at high risk for lung cancer, oral cancer. And so we do the oral cancer screenings here, and we just want to make you aware that it does put you at high risk. So some things we obviously recommend is to quit, but it's hard to do it just like that. So I want to give you some tips. So I tell a lot of my patients who smoke this, and they said that it worked perfectly. It really helped them out a lot. So what they did was they took however many cigarettes that they smoked a day and they put in a bag. And then they put the pack somewhere where it wasn't easy to get, and they just kept that plastic bag with them throughout the day. So that way, that's the only ones that they could smoke, and they just planned it out throughout the day when they should smoke a cigarette. So then the next day, they would take one out. So if they started with 5, the next day they would start with 4. And they would slowly get to where they wouldn't smoke any cigarettes a day. So this, I've gotten lots of great feedback with this, and they said that it really does help a lot. So I recommend trying this out. And if it doesn't work the next time you come in, we can talk more options. Talk about maybe some medication or the gum that could possibly help. So start out with this. I know a lot of people say that the gum and the meds don't help. So I like to recommend this first and try this out and see if it helps. And if not, we can go from there. You said also that you are getting married and you want your teeth to look white for your wedding. So smoking really stains the teeth, and so I would maybe use that as just an incentive for you to do this and to really quit and put your mind to it, and put those cigarettes in a bag and just plan it out to where you dwindle it down to just one cigarette and then none at all. So I look forward to your next visit and seeing your progression, and I just want to thank you for coming in today.